Let's talk about the AIRVO and applying it to a patient that is on high flow cannula. Before you even go on the transport, one of the things you want to think about is how much oxygen the patient's on and what their O2 demand is, and whether you have the oxygen reserves to support it. Also, whether the patient could decompensate and it would be better to place the patient on mask, BiPAP, CPAP, or intubate them before transport. Once you arrive on scene, you might be able to use the AIRVO canister and tubing that the patient's on if they're already on AIRVO. If they're on Vapotherm or a wall source though, you're gonna have to set up your own circuit. The way that you set up the circuit is you spike a bag of saline, either sterile water or normal saline is appropriate for our duration of transport, and allow it to fill. What you want to make sure happens is it doesn't fill past this dark line here. That would indicate a failure of the baffles inside. It may not fill all the way to that line, but all you're looking for is for it to cover the bottom of this metal plate. Once it's partially filled, you're going to push down on this blue latch and slide it in with these holes facing the ports on the AIRVO. Then it's going to ask you to connect the circuit. The circuit is the same whether adult or junior. To insert it, you're going to pull back on this blue latch, place it on the port, then slide down on the blue latch. The beep indicates that it's connected and it generates flow. Next, we're going to look at the cannula size. To find the right cannula size, there's a cheat sheet on the side. This tells you the size of the cannula and you can compare it to the size of the nair. When I look at the nair and the cannula size, I'm looking for about 50% nair occlusion so that I can provide a little bit of CPAP with the flow. When I connect this up, I line up this white piece here with the white arrow and give it a small push. As you get ready to switch this out, it's probably best to have some suction handy. That way you can suck any mucus out of the nairs that'll prevent the most optimal flow to be delivered to the patient. Once you've suctioned the nairs, you can place the AIRVO cannula. The OptiFlow cannula is designed to be adhered to the patient using these adhesive straps. These should not go over the ear since they have metal rings around them that prevent them from collapsing, but they're not comfortable around the ears. Finally, it's probably best if you put a passy in place to preserve the flow and to comfort the patient during transport. This will minimize the leak that comes out of the oropharynx. When we look at this screen, we see several indicators. First off, we see a bird and a butterfly. This tells us we're in junior mode. To change from junior to adult, we're going to press and hold this play button for 5 seconds. After 5 seconds, you'll hear a beep and it'll tell you that the settings have changed. In this case, I'm going to put it back in junior mode since we're using the OptiFlow Junior cannula. The next thing you'll see on the screen is this spinning wheel in the middle that tells us we have not yet reached our parameters. Once the parameters are reached, this wheel goes away and we hear a tone. The check mark indicates that we've reached the parameters we've asked it to achieve. To check or change those parameters, we're going to press this play button. This cycles through the temperature and the flow rate. If we want to change the flow rate, we're going to press down on the up and down arrows at the same time for 2 seconds. In general, 1 liter per minute of flow per kilogram of patient weight is a good place to start, and you can go up to 2 liters per minute of flow per kilogram of patient weight. If we want to change it, we select the number we want to go to, then press play again. The next stop is FiO2. Now you can't adjust the FiO2 from this screen. It's just a monitored FiO2 of what's delivered to the patient. In order to adjust the FiO2, you need oxygen tubing. We're going to connect this clear oxygen tubing to the side of the AIRVO, then to an oxygen source. We adjust the FiO2 by adjusting the flow rate on the oxygen source. You'll see that reflected on the screen as the delivered FiO2 begins to increase. Remember, what's delivered to the patient is a mixture of gas and train from the bottom of the AIRVO and from the oxygen port. For that reason, it's important to set the AIRVO on a hard surface or a flat surface, not on a bunch of blankets, so that it can entrain room air to mix with the FiO2. If you need to nebulize the patient, in the AIRVO kit, we have the Aerogen kit. This includes an Aerogen Solo, an adapter, and a T to fit in line. The adapter fits on top of the T. You can fill your Aerogen, connect it up to power, and then place it in line. You're going to hear a brief alarm as I disconnect the patient, then reconnect it with the Aerogen in line. If you have a failure of the Aerogen during transport, you can replace the circuit with this green oxygen tubing and connect it to a wall source. Once you've connected this to a wall source, then you can come over and connect it up to the patient. This allows you to still provide flow to the patient even though it's not warmed and humidified. If you want to add some humidity, keeping the Aerogen in line with saline or medication in it will provide some level of moisture, but not a high level of humidity because it's not heated. But this will allow you to continue to provide that level of flow to the patient. If you're on 8 liters of flow on the AIRVO, you'll probably want to start on 8 liters of flow on the wall source. That'll give you time to set up for thinking about your other options at that point, whether you want to think about transitioning to mask CPAP or intubating the patient. Should you need to do that on a child, in our PD bag, we have masks with hooks and straps that will work to use the Hamilton with mask CPAP during transport. Again, these are things you want to think about before transport as well, but should you encounter an emergency, they're backups or adjuncts that you can use in transport. Hopefully that gives you a good overview of the AIRVO system, the approach to the patient, and some of the tools that you have en route.